Welcome to an essential guide on understanding heart failure. It's a condition that affects millions worldwide, yet its complexities can often be misunderstood. In this video, we'll break down heart failure using the clear and comprehensive guidelines from the American College of Cardiology and the American Heart Association, helping you understand what it is, how it progresses, and how it's classified. First, let's establish a universal understanding. Heart failure is defined as a clinical syndrome where the heart cannot pump enough blood to meet the body's needs. This is due to a structural or functional problem with the heart itself. This condition is often confirmed by symptoms like shortness of breath or swelling, and objective evidence such as elevated natriuretic peptide levels in the blood, or signs of fluid congestion in the lungs or other parts of the body. The ACC/AHA guidelines categorize heart failure into 4 progressive stages, helping both patients and clinicians understand the disease's journey and guide treatment strategies. Stage A describes individuals who are at high risk of developing heart failure, but currently have no structural heart disease or symptoms. Think of it as a warning stage. Risk factors include conditions like high blood pressure, diabetes, obesity, or a family history of heart disease. At this stage, the focus is entirely on prevention and managing these underlying risks. Moving to Stage B, or pre-heart failure, means structural heart disease is now present, but you still don't experience any symptoms of heart failure. This could be due to conditions like a previous heart attack that damaged the heart muscle or issues with heart valves. The heart has undergone changes, but it's still compensating effectively. Early intervention here is crucial to prevent progression. Stage C is where symptoms begin to appear. Here, structural heart disease is present, and you either currently have or have had in the past symptoms of heart failure. These can include shortness of breath, especially during activity or when lying down, persistent fatigue, and swelling in your legs, ankles, or abdomen. This stage requires active management with medications and lifestyle changes to improve symptoms and prevent further worsening. Finally, Stage D represents advanced heart failure. At this point, symptoms are severe and significantly interfere with daily life, even with optimal medical therapy. Patients in this stage often require specialized treatments, such as heart transplants, mechanical circulatory support devices, or palliative care. The goal here is to improve quality of life and manage severe symptoms. Beyond staging, heart failure is also classified by how well the heart's main pumping chamber, the left ventricle, contracts. This is measured by the left ventricular ejection fraction, or LVEF. HFrEF, or heart failure with reduced ejection fraction, means the heart muscle is weakened and pumps less than 40% of the blood out of the left ventricle with each beat. This is often referred to as systolic heart failure. HFmrEF, or heart failure with mildly reduced ejection fraction, is when the LVEF is between 41% and 49%. This category acknowledges a middle ground where pumping function is somewhat reduced, but not as severely as in HFrEF. HFpEF, or heart failure with preserved ejection fraction, occurs when the LVEF is 50% or greater. Here, the heart muscle contracts normally, but it's stiff and doesn't relax properly, preventing it from filling with enough blood. This is often called diastolic heart failure. A newer classification is HFIMPEF, or heart failure with improved ejection fraction. This applies to patients who initially had a reduced LVEF of 40% or less, but whose LVEF has since improved by at least 10 percentage points and is now greater than 40%. This highlights the potential for recovery in some patients, though ongoing monitoring is still essential. The ACC/AHA guidelines also emphasize the importance of precise language. Instead of stable heart failure, we now use persistent heart failure to reflect that even when symptoms are managed, the underlying condition and risk remain. Similarly, heart failure in remission is preferred over recovered heart failure, acknowledging that while symptoms may resolve, the potential for relapse still exists. These terms encourage continuous vigilance and management. Understanding heart failure, its stages and classifications is a